Welcome to the Eye Clinic. This video is about macular degeneration and how it affects your sight. Macular degeneration is an age-related deterioration in the retina that generally occurs in the center part of the vision, which is called the macula. It's particularly bothersome because it affects the center vision, which is the part of the vision that you use most to read and see small details and colors. Typically, macular degeneration occurs in people over the age of 65, but there are exceptions to that rule. There is a layer of cells under the retina that are kind of like the cleanup crew of your eye. They keep waste products from building up under the retina. In macular degeneration, it's not determined exactly how this happens, but those cells that clean up the waste products start to die off and there aren't enough of them. So what happens is waste products start building up under the retina, and this makes the retina that's on top of it sick. And these form little white spots in the retina that can be seen on your eye exam. If these grow larger, you can get blind spots in your central vision, and that's called dry macular degeneration. Some people develop it because of genetics, some of it is environmental. Smoking is a risk factor. The only treatment option for dry macular degeneration is a vitamin formula called AREDS 2 vitamins. There was a study done a few years ago that determined the particular vitamins that strengthen the retina and make it resistant to deterioration. They don't cure macular degeneration, but they do slow it down, and it's the best treatment option that we have at this time. If dry macular degeneration continues to get worse, you can develop wet macular degeneration. And what happens is there is a barrier between these blood vessels that are under the retina and the ones that are in the retina. And the barrier breaks down because of the buildup of waste products. And the bad blood vessels come in under the retina, kind of like a vine growing in under a fence, and they start leaking like a soaker hose underneath the retina and cause puddles of fluid. And that causes waviness in the vision, distortion, and it can also cause a sudden drop in the vision. If this occurs, there are special medicines that need to be injected into the eye to cause these vessels to dry up, and usually you're referred to a retina specialist at that point for treatment. We do a dilated eye exam once a year on almost everyone who comes in for a regular comprehensive exam. And we examine the macula with a special lens at the slit lamp, and that's the light that you look into. And we can see if there are changes in the macula that indicate early macular degeneration. It is somewhat hereditary, but heredity is not the only thing that causes macular degeneration.